All right, all right. Good evening, y'all. What's going on? It is yours truly, Dr. Barry Pierre. First of all, can I say Happy New Year and say that I have missed you guys? It has been, I think, about 3 weeks since our last episode of Real Physician Reacts. If this is the first time catching me, watching me, I am yours truly, Dr. Barry Pierre, your favorite board certified internist, host of Real Physician Reacts. This is where I come once a week, usually Thursday evenings, and give my point of view on either social media posts, social media, some videos, news clips, whatever, on the health related tip. And I just kind of give the point of view as the physician, as real as it gets. And we've got a couple videos to discuss this evening. Of course, especially if you're catching this on the day this drops, again, the year 2022. Again, this is our first episode. I want to shout out everyone who has taken the time to catch this, whether you're watching this on Facebook, whether you're watching this on YouTube, Twitter, or I was gonna say another Periscope. I don't even think that's alive anymore. As well as LinkedIn, right? So if you are here again, I appreciate your level of support. Make sure you not only hit that watch. In fact, let me put my little banner up so you know where to go to. Let's put the banner up so you know exactly where you go to. Go to watchdrbarry.com. That takes you directly to our YouTube page. This is where I primarily go live at, but I've given the opportunity to kind of stream out to my other social media platforms for now. Make sure you are subscribed to our YouTube channel where you catch this series. Real Physician Reacts happens on Thursdays, as well as Medicine Mondays, which happens on Mondays. And I'm thinking about dropping something probably sometime this in the first quarter as well, to another kind of news type clip to occur on my YouTube channel, for guys who just like to watch the video related stuff. So let's kind of get into the nitty gritty of what we're going to discuss. So we have 2 video clips today. They're not long, but the discussion will kind of go through a journey of what the Omicron variant is doing, right? Again, unless you're living under a rock, you know that we are now going through what some would say our 3rd or 4th wave of COVID cases, and primarily due to the Omicron variant. If you are unfamiliar with the Omicron variant is, catch this week's Medicine Mondays episode. It's under my playlist on my YouTube channel, or it's actually a podcast episode as well too. I think it's episode 205, where I kind of give an introduction on what the Omicron variant is, what it's doing across the world, and more importantly here in the United States for short. So let's again. So we'll be talking about the Omicron variant. We're going to be talking about kind of the CDC recommendations. We'll actually be reading what the CDC kind of recommends now if you test positive for COVID, and what's got a lot of my colleagues perturbed. I'll just say perturbed. I'll say it now. We'll keep it G-rated, right? Just in case we got kids and up who are watching this, right? So we won't curse on here. A lot of my colleagues are very upset at the new CDC recommendations as far as quarantine. We'll discuss that. We'll also be talking about school closures that are starting to happen across the country as well. Why? Because obviously the cases are running up, right? So let's get to the video at hand. Let's see here. And I usually make myself kind of the bigger video, but I've had some feedbacks that people said they like to kind of see the video in the bigger format. So, I do this for y'all. So let's take a listen.
In the fight against COVID-19, growing confusion as America faces more uncertainty. The virus wreaking havoc on businesses, many dealing with more employees calling out sick. Near Buffalo, New York, Starbucks workers walked out over COVID concerns.
The needs of the business are not my concern. The needs of my fellow coworkers and partners and customers are my concern.
So I want to stop there. You know how we do this on Real Physician Reacts, where we kind of give my 2 cents and then we kind of get moving. I love that, because when we talk about what COVID has done, it's really, unfortunately, placed this kind of war between the employer versus the employee. And of course, again, as an entrepreneur myself, I 100% understand, the needs of, needing your business to run. 100% understand it. But as an employee as well, I'm an employee as well too. I understand the importance of, the employees' rights. And what you see a lot of things that are kind of happening. I'm in the state of Florida, where our governor acts like COVID really isn't a big deal. and he fights mandates. He fight not even vaccine mandates. He fights mask mandates. Like he just fights it tooth and nail, despite the fact that his kids go to school that require masks and vaccines. And whole nother discussion, we won't go here on this episode. But so I understand that there's lots of parts of the world, and especially here in this country, that want to like move on to the next thing. Like, all right, guys, like let's stop treating COVID like a serious thing. But every time we do that, we end up right back in the situation like we're in now. And with Omicron variant essentially just kind of running up the score, we're having, again, we'll see some John Hopkins and CDC numbers as far as certain numbers of cases that have been happening like daily. Like on this past Monday, what happened is all of the states reported their holiday numbers because obviously they were out on break, and we had 1 million new cases of COVID, again, get documented like for this past Monday. So it's been so unfortunate to see us go through calendar year number 3, right? Year 2022 is calendar year number 3 dealing with COVID-19, and we still not really having a grasp on how to do this thing correctly. So I love the fact that she's like, yeah, I don't care about the business, right? I care about myself. I care about my friends, my family. I care about, the customers who come to see me. Like, and if the stuff isn't right, like we're walking out. So you had that Starbucks, scenario where I guess they were like on strike or something because, people were playing games, with the recommendation. So I love it. Again, I'm team employee all the way, despite the fact that, again, I run a business and I have employees myself.
The American Medical Association blasting the CDC's decision not to require a negative test for asymptomatic people to end their isolation period after only 5 days.
So we're gonna talk about that, and obviously I want to keep that screen up. Like the new recommendation of quarantine isolation are not only confusing, but are risking further spread of the virus. And we are going to be talking about what the CDC has kind of recommended after we watch our clips that got a lot of my colleagues, including myself, very upset. What they essentially did was kind of reduce the number of days you had to be on quarantine. And it said like, hey, you know what? You don't even have to test negative. Like, spend your 5 days and you're good to go, right? As long as you're asymptomatic. And that, again, that is a blow, especially from a public health perspective, but especially from a perspective that we know that a lot of people are going to go back to work, even if they, after the 5 days, even if they may be a little bit symptomatic, they're going to go back to work and they're going to spread it to others, right? We just know that's going to happen, and I can't blame them, right? Because again, and when I think about when we think about what it means, right, to have to call off of work, and that's just, especially as a physician, and growing up, right, understanding the importance of having to, like, not wanting to go to work, but having to go to work. The fact that a lot of people don't have the ability. Let me zoom myself in real quick. A lot of people do not have the ability to take a week off, 10 days off. They just don't have it. It's why many of us go to work when we're not feeling well or we're not feeling 100%, because bills got to be paid, right? The rent, the mortgage still got to be paid, the lights, right, still got to be paid, right? Electric still has to be paid, water bill, like all the bills don't stop coming just because I don't go to work. And when you don't have that back end support, especially from a financial perspective, right, you can't expect people to want to stay away, right? And I want us to make sure that we caution ourselves, especially I don't blame, like I said, I don't blame people wanting to get back to work, aka wanting to get back to making some money, because bills are here, people need to eat, people need to sleep, people need to drink. So I don't blame that, but it's just this onus of like, oh, by the way, 5 days is cool now. And mind you, it's not just the CDC. Even if you look around, especially you're looking at these sports leagues now, like the NBA, the NFL, all of a sudden the COVID protection rules that they had before, and now that they're seeing, especially if you caught a couple Real Physician Reacts, I think a month ago, where I talked about how it's kind of running amok amongst these sporting agencies. All of a sudden they want to change the rules. Well, you know what? Maybe you don't have to stay as long. Maybe you don't have to. So there is a lot of pressure coming from the top, right? Coming from the top, especially from a business perspective, to get these employees back on the job. A lot of pressure. And again, not to say that there's no pressure from the employees, not to say that the employee doesn't want to go to work, but let me tell you, there is a lot of pressure from the top, from employers saying, hey, we need you back here. Like we will not survive. Like NFL, like we need our players back. NBA, we need our players back. Healthcare institutions, hey, we need the doctors and nurses to come back. After 5 days instead of 10, because we can't afford to pay for all of these other people coming out here, right? So again, it is very telling what you're seeing here, that I think a lot of it isn't really, again, they'll like I said, we'll talk about the CDC, we'll even read it. I don't think a lot of it is based 100% on the science. And as a person who champions, right? And people know me, I've always championed, recommendations from the CDC and everything else, right? But when I see something that looks crazy, like I have to call it out as well too, or I wouldn't be consistent in, the way I do my things here. So let's keep watching. I'll make myself small.
The AMA saying in a statement, quote, the new recommendations on quarantine and isolation are not only confusing, but are risking further spread of the virus. Many people across the country now struggling to get access to testing due to the high demand.
And that's why I kind of made it my YouTube cover, as far as, now, right? Because so many people are coming down with COVID related symptoms. Guess what's happening? Now we're having a logjam of getting people tested. Like you can't even walk into your local pharmacy and just pick up a test kit, right? Like it's sparse. And I was in a clubhouse with, I know it's Dr. Keisha, but I don't know her last name, and I apologize. She's a pathologist, and she posted this link, and I wish I had it. Like, in fact, when I do get it, I will definitely make sure I add it to the YouTube show notes, as far as where you can get testing as, because it's gotten so bad that people are going to the point where they're ordering tests online, and those tests may not even be FDA approved to be accurate tests. And then they're doing the test wrong. Some people are swabbing their mouth when they should only be swabbing their nose. Like, just so many different things that you wouldn't have to think about that are happening. And when we think about, this influx, and we see like this significant amount of cases that are there, knowing that there's a lot of people who still don't have access, that should really give you an idea of just how bad it's gotten over this past quarter and a half, especially, and because we knew what was going to happen. We knew that a variant was going to occur. Like I said, please check out this past week's episode. I'll put it in the show notes as well. So we knew it was going to happen, and we knew that it was going to be that bad. And of course, when it got that bad, now when people want to get tested to say, hey, do I have the flu? Do I have a regular cold, or do I have COVID? Right? Now they're scrambling for tests, right? Which is definitely sad. So as you can see here, it's getting to the point where even finding tests, an appropriate test at that matter, is becoming an issue.
I think CDC is in a tough spot because there aren't enough tests, and they're trying to find alternative ways of moving forward.
The director of the CDC pushing back, denying that the new guidance had anything to do with testing shortages.
If you have access to a test, and if you want to do a test at day 5, and if your symptoms are gone and you're feeling well, then go ahead and do that test.
Now, again, that's again, I always caution, especially a lot of my colleagues and just people I see online, I always caution them to make sure you're talking in general terms. Like mind you, when I say go and get a test, these tests aren't free, right? A lot of these over-the-counter tests are not free. A lot of people do not have just the financial ability to just go pick up a test, which is why you see a lot of people, kind of clamoring to see if, we can get government support in providing tests to, people across the country, because we know that there's going to be some economic hurdles that are going to prevent people from getting tested. And if those same economic hurdles are preventing people from even paying for a test, you best believe those same economic hurdles are going to prevent someone from calling off of work because they're feeling sick. No, they're going to go to work because, hey, I got to pay bills. Like, again, the cycle is there. It's right in front of our face. And we know those in lower socioeconomic status, those are the ones who will always be affected much more severe than others, right? So again, I always caution us when we just say like, oh, just go get a test, or go get your mammogram, go get, like, all of these things. Like, there may be a cost associated with it, and we have to understand that, like, when we're saying just go get, we're almost speaking from, I don't want to say an elitist, but almost like, like a above a type attitude where we could just assume that everything is just readily accessible, when for a lot of people it is not. And then this is just a graph here. We're going to show some graphs from John Hopkins as far as just the number of cases. But as you can see, like, look at the numbers. Like, look at the wave. If someone asks you, and I said this in my last Medicine Mondays episode, hey, Dr. Barry, when are we turning the corner on this pandemic? I just show them this graph and say, if I told you that over time the graph kept getting higher, do you think we're doing a good job or a bad job as far as controlling these cases, right? So as you can see, this peak as far as new cases just continues to rise, even worse than the one, and you see around that November timeframe, that is, and if they go a little bit early, that's when, especially when the Delta variant was really kind of running amok during that summer timeframe.
This comes as the CDC averages more than 574,000 cases each day. The CDC now recommending children as young as 12 be boosted.
So that's how bad it's gotten, y'all. It's gotten that bad that now they're like, you know what? Anyway, and the reason why they're now recommending the boosters, because with the Omicron variant, we are seeing that those who just got the 2-dose vaccine, Pfizer, Moderna, or just the 1-dose Johnson & Johnson, they aren't as protected as those who got the full series, aka the boost, like myself, right? Of course. So they do see that if you do not have the booster, like, not to say that you are not protected, right? Let me make sure I preface that, right? Because I don't want someone to like clip my video and then say, oh, Dr. Perry said you're not protected if you didn't get the booster. Didn't say that. But what I am saying is that when we compare those who just got the 2 versus those who got the booster, the ones who got the booster seems to be much more protected, right? Like, again, that's all we're saying. And that's why you're seeing a push to get the booster. That's why you're seeing, again, the CDC recommending now, like, hey, 12 to 15, go. You can also go and get boosted yourself, because we're seeing the protection is there. And as a father with 3 children who don't meet these age requirements, of course, I got to be a little worried, because yes, my kids are vaccinated, but they're not even eligible for a booster, right? So again, they're protected, but they're not as protected as you can, especially dealing with this new variant of the Omicron variant.
As health experts predict a rough month ahead.
People should try to do everything they can to be careful and thoughtful about their activities and their masking.
In Washington, I'm Chris Wynn.
So that was the first clip. Like I said, it was just again, kind of really nitty gritty, talking about the CDC, talking about kind of the quarantine numbers. Let me zoom myself in. Talking about the CDC quarantine, talking about our thoughts, and really wanted to kind of give our perspective as well. And before that, let's just go, before I go to the next video, let's go to what the CDC guidelines recommend as far as some of their changes concerned, just so people can kind of get an idea why some of us may be a little bit upset. Let me see myself. Yeah, I wanted to make sure I was smaller. Okay, so I want to make sure you guys can see that. First of all, again, like I said, I love the CDC quarantine and isolation. It kind of gives a breakdown of what quarantine is: a strategy used to prevent transmission of COVID-19 by keeping people who have been in close contact with someone with COVID-19 apart from others. Now, mind you, this just says close contact. This doesn't even talk about testing positive for COVID. It just says if you've been in close contact with someone who has tested positive for COVID, these are our recommendations. A lot of people miss that aspect there. And then close contact is someone who was less than 6 feet away from an infected 6 feet away from an infected person for a cumulative total of 15 minutes or more over a 24-hour period. And again, so just to kind of get an idea, so obviously if you live with the person, boom, you're there. If you went to school with a person, aka my classmates, my students, boom, you're there. My hospital, like employees, boom, like you fit that description, just so people can understand what close contact is. So who does not need to quarantine? Because I think this always gets missed on a lot of people. If you came into close contact with someone with COVID-19 and you are in one of the following categories, hey, guess what? You don't actually have to quarantine. You are 18 and you received all the recommended doses, including the booster. So including the booster, hey, you know what? Just because you were with them, and just because they got tested positive, you don't necessarily need to test positive. If you are ages 5 to 17 and you completed the 2 rounds of Johnson Johnson, the Pfizer or Moderna, you don't need to quarantine. You had confirmed COVID-19 within the last 90 days. That's an interesting one, right? So they're essentially saying if you tested positive for COVID-19 in the past 3 months, and just because you came into contact, again, we're not even talking about if you yourself test positive. This is just close contact. If you had it 3 months ago, right, and you came into contact with someone who ends up having it, you don't have to quarantine. And the reason why we say that, and I've kind of talked about this in the past, what we know with those who become infected with COVID-19, the antibodies that you develop, again, and this is the argument I always have with people who say, natural immunity, I'd rather get infected. First of all, you would not rather get infected and play with the lottery and hope that you don't get sick and end up in a hospital, end up with a trach or a peg, seeing me. That's not the Russian roulette you want to play. But it says if you happen to get infected and you test positive and you come through it, your body does build antibodies, but we know that the antibodies that your body builds from an active infection does not last as long as those who've gotten the vaccine, which is why we still recommend getting the vaccine despite you getting COVID. The amount of people I've talked to, which is crazy, the amount of people I've talked to who said, oh, I got COVID last year, so I don't need to get the vaccine. And I have to educate them, just like we're educating today, is kind of mind blowing. But a lot of people fit that way. But more importantly, who should quarantine? Again, essentially, though the opposite, right? If you're 18 or older and you completed a vaccine, but you have not gotten the booster, they're saying, hey, you should quarantine if you have not gotten the booster. If you got only 1 dose of the Johnson & Johnson and have not gotten the 2nd dose of the Johnson & Johnson for a booster, you should quarantine. If you are not vaccinated, you should quarantine, right? So, and again, I hope people kind of get this, because I think this gets lost on a lot of people as far as who the CDC recommends quarantine. Now, again, there's clinical, obviously go to your doctor, I always say that, right? Assume that I don't know anything, right? Assume Dr. Barry doesn't know anything. Always follow up with your doctor. But again, from a CDC guideline recommendation, this is the people who we say should quarantine and who don't have to quarantine just because they come in close contact. And where we got upset is that now it says stay home away from other people for at least 5 days. This used to be 10. After your last contact with a person with COVID-19, the date of your exposure is considered day 0. Essentially, if you were next to them on Monday, that's day 0, and then you count 5 days from there. And then for 10 days after you lose close contact with someone with COVID-19, you have to watch for fevers, cough, and this is essentially saying if you had symptoms in that regards, right? So again, this is where you're getting a lot of the uneasiness from healthcare professionals, public health professionals, right? If you do not develop symptoms, get tested at least 5 days after your last close contact with someone with COVID-19. So they're saying, yeah, go ahead and get tested after 5 days if need be. If you test negative, you can leave your home, but they still want you to wear the mask until day 10, right? And I've had to talk to a couple of people about this, right? So if you test positive for COVID-19, you quarantine for 5 days, you test negative, they still want you wearing the mask for an additional 5 days. If you test positive after your 5 days, you should isolate again for 5 days as well. Right. So again, that's where, again, it's not that 10 to 14 days that it used to be. And that's why us as healthcare professionals were kind of going a little bit crazy on what's going on here, especially from a CDC standpoint. And like I said, I can put this link in my YouTube show notes as well, just so you guys can kind of read some of the description yourself. In fact, give me a second. Give me a second. Give me a second. Put that link right there for you guys. Perfect. Yeah, I put it in the comment section. So check out the comment section. So let's watch the second part of the video. Let's see. Stop sharing my screen here.
COVID numbers soaring nationwide. Hospitalizations now at about 113,000, according to the Department of Health and Human Services.
This could be our new normal going forward. Every year or every few months even, we could be seeing these massive surges of cases.
The COVID.
Now that of course that's going to scare some people. That's going to scare some people, and that is what, you know, especially again if you're a part of the lunch learning community, this really isn't news to you, but again, if this is your first time catching it, welcome. I've talked about the fact that we are going to have to get used to the fact that COVID is here. It's not going nowhere. It's not disappearing. We know that, right? And I don't want those who are anti-vaccine to insult our intelligence and make us think that we think it's going to disappear. We do not think that. But what we do know is that because it's not going away and because it's still crazy contagious, that prevention will always be the best weapon. And guess what? How you can prevent getting the disease? You get vaccinated. And the amount of people, right? The amount of the amount of detractors, right? And if you have no idea where somebody, especially you may be thinking like I can't believe there's people who are actually against vaccines or against mask mandates. I want you to when you got some time, go to watchdrbarry.com. Check out some of the comments that I get on these Real Physician Reacts videos. They absolutely go crazy. Like they just find, I don't know how they find it. They just find it. So check out the comments on my YouTube channel, just so you can see that, yeah, there's a lot of people who really think crazy, right? It is what it is. There's a lot of people who think this way. So understanding that, yes, this is going to be a new norm. Yes, COVID's not going nowhere, but we're going to need to protect ourselves, or we're going to have school shutdowns, or we're going to have, I'm not sure if we'll ever have a nationwide lockdown again, because a lot of people lost a lot of money, and we know money talks in this system here, especially here in the United States. We know money talks. So I don't know if we'll have a nationwide lockdown again. Knowing all these things you have to do everything you can to protect yourself, because if you do not, right, you can fall victim. And when I say you can fall victim, I'm not saying only you as being unvaccinated, but definitely being unvaccinated puts the biggest bullseye right on your head, right? Like if you are unvaccinated and you're walking around freely, like there ain't no issues there, you are walking around with the biggest bullseye that, again, and there's nothing I can do. There's nothing we're going to be able to do for that. But the problem is that because you walk around with that big bullseye, if you do happen to get it, guess what? Now you go home and you infect your mom. Go home, you infect your dad, you infect your grandma, you infect your brother, your sister, your son, your daughter, right? Like it's usually not just you who's going to be affected, because this disease is so contagious as it is, as we're seeing with this Omicron variant. Like I said, we'll take a look at the video. So I want people to really wrap their mind around what she said. Like we may have to, live in a world where we expect to have a significant amount of cases. Now, of course, we're hoping that significant doesn't mean 500,000 every single day. We're hoping that's not the case. Like we're seeing, like as I'm recording, especially if you're watching this live or you watch this within that week or so. But like that, it is what it is, man. It's a scary time right now.
Surge impacting some school systems. In DC, students must have a negative COVID test before returning Thursday. Detroit delayed school return going virtual through at least January 14th.
That's the safest thing to do in the city of Detroit, where infection rate is over 7 days, exceeding the 40% range.
In Chicago, classes are canceled after the teachers union voted to go virtual. The school system considers the move a work stoppage, and teachers will not be paid.
So That right there, y'all know me. Y'all know one thing about me, one thing I've said, from the beginning of time, that like no profession is revered by me more than the profession of the teachers, because I'm not here if someone doesn't teach me, which is why, like, ironically, why you can watch me right now, because someone taught me so well, and I said, you know what, if they can teach me so well, I need to teach the masses as well too, right? Like, that's what drives me to do what I do. I don't have to do this. Like, I'm pretty accomplished physician just doing physician things, but like, it's the education aspect that I really, really love, that I really will spend, Thursday evenings, right? And like, when my kids are asleep, educating you guys, because that's what I absolutely love to do, because I know if I could just touch one person, two person, three person, I can save someone's life. So when you hear, right, and this again, we kind of talked about employer versus employee. Here you have the teacher saying, hey, the cases are running up. The cases are running up so bad, you know what? Let's do virtual school. And you have the school board saying, like, oh, you know what? We're counting that as an absence, and you're not going to get paid. Think about that. They're gonna count. So mind you, the teacher didn't say, I'm not doing any school. Like, I'm not doing no virtual, no hands-on. They just said, hey, you know what? It's not safe right now. Like, I can only imagine what the classroom, dynamics are at some of the schools. You know what? We let's do this. We'll do virtual. Like, we're okay doing virtual, because obviously the teachers have to protect themselves. The support staff have to protect themselves. Like, everyone has to protect themselves. But the school board is like, oh, if you do that, you're not going to get paid. So if I'm a teacher, like, what does that mean? Does that mean that I not even do the virtual? Because if you're not paying me, if you're not going to pay me to do virtual, that means you're not paying me. And if you're not going to pay me, do I have the obligation? You don't, to like sit up and teach virtual? No. But of course, what you'll likely see is teachers still wanting to do it, because again, teachers have, when you're a teacher, when you're an educator, and that's what you love to do, you do it even when they're not paying you well. Or even when they're not, definitely when you're not paying you well, but you do it even when they're not paying you. So again, so that hit me, right? That hit me because again, it was one of those things where I said, business talks. Like, I've talked about this. Like, we lost a lot of money with all of these shutdowns, and a lot of businesses are like, we are not shutting down again. I'm okay with people dying. That's essentially what they're saying. I'm okay with people eventually, possibly getting sick. I'm okay with people possibly getting the kids sick. I'm okay, because I figure a certain number of people who do get sick, that's not going to be enough to kill my bottom line. That's essentially what they're saying. Because if the latter was the case, if the opposite was the case, where like, oh, if I send these teachers to school, like, I'm sending to the slaughter, and that's going to cost me way more money than long run, like, they'd have a different tune. But because they understand, like, you know what, it's a smaller risk. Yeah, we may lose some people. I'm pretty sure they're not going to publicly say it. I'm pretty sure they're like, yeah, I'm okay with losing a lot of people. And now, mind you, and I'll talk about that, because a lot of y'all, right, I won't say y'all, I will just say the general public, a lot of people were very comfortable with the fact that, like, oh, COVID is an old person's disease, which means only the old people will die. A lot of y'all, again, we're not going to even say no names. We're not going to say no names, but a lot of people were very comfortable with the fact that, oh, COVID is just a old person's disease that will only kill old people, until COVID started killing young people as well. And you're like, oh, right. So again, not here nor there, right? Just something to think about. And like I said, I was very taken aback when that school board took that position, because that told me, like, oh, big business is there, right? And again, mind you, as a parent, again, I got 3 kids. I understand why parents would want their kids to go to school. And that kind of goes back to that dichotomy. If I got to pay the lights, if I got to pay the electric bill, if I got to put food on the table, I can't do that if my kids aren't away so I can go to work. So again, like, it's one of these things where, like, I understand both sides, but you best believe I'm never going to go against my teachers, right? Especially if they don't feel that the conditions that they're being provided are safe enough for them to do their job.
The teachers union does not believe the current measures in place are safe enough to return to school.
We failed by the mayor, we failed by the public health office, and teachers and the school staff have decided we have to. The only thing that we get control is whether we go into the buildings.
The country's third largest school district insists going to class in person is safe because of mitigation measures. The Biden administration provided billions of dollars in funding for resources for schools during the pandemic and believes schools are safe for kids.
Like I said, they kind of try to dress up the fact that, the government gave billions of dollars, but just because the government gave billions of dollars for infrastructure doesn't mean it actually got to where it needed to get to. So it was just one of those things where, like, yeah, sure, the government gave money, but did the teachers in Illinois get that money in their pocket? Right? Did you guys fix the air system of old schools that needed to, like, did you do all of that? Probably not. So again, I thought that was like, yeah, whatever. Like who cares if the administration gave money, especially when it's about my safety. And especially, and I've said this before, because the video's almost done. I've said this before, right? Once, like, especially with these businesses, right? Like, I'll just put it in the sense of the hospital. In the hospital setting, right? Like, I work for the hospital. Let's say I work for a hospital 10 years, 15 years, 20 years. Great. But if I die, right? Like, let's say I pick up COVID and I die. You know what happens? They send one email saying, hey, you know what? Dr. Pierre died, right? They send one email, Dr. Pierre died. Here are the funeral arrangements. They send another email, hey, this is Dr. Pierre's funeral. Go if you want. Go if you want to. If you can, if you're not working that day, like, you can go ahead and attend. And after that, they put another doctor in there, right? So understand that these businesses will always be for the business. So as an employee, as my teacher, right, as my healthcare worker, as my essential worker, who, low skilled, whatever that means. Like, I saw that one video. I was going to talk about that, but I didn't even want to go that far. When you're in that position, you have to understand that you have to think for yourself, because the business is not thinking in your best interest.
To go back.
Parents want schools open, and experts are clear that in-person learning is best for kids' physical and mental health and for their education.
Now, again, that may be true, right? That may be true that the parents want the kids to go. Yeah, I'm pretty sure some of them. And again, I kind of talked about the financial. They may be better mental, and physical, association relationships of going to school. 100% agree with that. But at the end of the day, it does not matter if you're putting yourself in a position where you can catch a communicable disease and end up dying from it, or getting very, very sick from it. That does not matter. It is what it is, man. So let me stop that stream there. So, perfect. All right. So again, we had a lot to touch on. Before I let you guys go, I want you guys to kind of just look at some of these numbers. Like, I purposely did not go to CDC because a lot of people, I seen this video. I seen it was a TikTok video. One of the doctors I follow stitched it, where, like, this lady is just talking about how if you see someone like me, right? You see someone like me spending their time on a Thursday evening, don't listen to them, because we are bought out by the pharmaceutical company. And I've said this before, and I will say this again. For all of the people who swear that we're being bought out by pharmaceutical companies, please tell me which ones and who should I contact? Because I would like to be, paid, for spending Thursday evenings educating y'all guys. I would love to do it. I'm not. I would love to do it. So when they keep saying, like, we're bought out by these pharmaceutical companies, I always ask, can you please send the contact information of the pharmaceutical company who's buying the doctors out? That way I can maybe get a piece of the pie too, right? I like to get paid too. So let's take a look at this Johnson & Johnson page. Let's see. Stop the screen. Take a look at Johnson, just so you guys can get a visual picture of what these cases have been doing here in this country, but more importantly across the world too. And then we'll let you guys get up out of here. Right. Like I said, we're going to Johnson & Johnson. We're not even going. We're not even Johnson & Johnson. We're going to John Hopkins because, like I said, people think this. A lot of people think the CDC pays me as well because I keep talking about the CDC a lot. But like I said, I get on the CDC and sometimes I champion the CDC when the CDC needs to be championed. So just to kind of get an idea look of the maps and trends worldwide, right? So again, this is just kind of all I see: United States, Italy, United Kingdom, France. These are just kind of all of the countries, and I'm gonna let you guys guess which country happens to be here. Oh, you guessed it right, the United States, right? So look how bad, guys. Like again, and you know, I wish I could stress it. Look how bad of a job the United States is doing when it comes to COVID. Right. If that is not a graphical like slap in the face to say like, hey guys, wake up. We aren't doing that good of a job. Like, stop it. Right. Like, we are not doing that good of a job. Like, look at the difference between us and like these other countries here. And again, I'll show you what the graph like. So this here looks like, yeah, like the peak looks like 710,000. The next one, it looks like it's France at 196,000, guys. Yeah, we're doing a bad job. Just to give you an idea, just so you can kind of look yourself. Here's the United States. Again, they talked about kind of the average cases they report here. Since the country is reported cases, the United States has 57,702,394 cases with 832,000 approximate deaths, right? Just fortunate. And this is just look at the graph, right? Let's say you don't even know the numbers, but you want to know, are we doing a good job at COVID or doing a bad job at COVID? Look at the graph, right? This here is early 2020, and look where we're at now. Look, like the mountain hasn't peaked yet. The mountain has not peaked yet. And this like, look at this time frame here, right? January 2021. This is July 2021. This is where the Delta was, causing an issue, where we thought it was a problem, and Omicron has just said, like, hold my beer. Again, United Kingdom, same type of graph. Omicron variant. Just to give you an idea of how bad the Omicron variant is. This is in France. Again, higher peak in France. Again, in Spain, higher peak. Italy, higher peak. Argentina, higher peak. So this here, right? This is the only country in India. You might remember about India is because India was the most stricken country for the Delta variant, right? As far as the number of cases. And you saw what the Delta variant was doing to them during early 2021, right? Just to give you an idea how bad the Delta variant is. And again, here you can already see it's starting to creep up. Is it going to like pass? Like, mind you, like their peak is about 400,000. And I'll just scroll up to United States again. Ours is closer to 800. So their peak isn't even close to our peak. Just to give you an idea of how bad. And to mind you, like the scale is there. But again, we're just for graphical reasons, right? Like, again, this is Australia, higher peak. Again, we're seeing this is Turkey seeing a little bump here. Germany seeing a little bump. So, like I said, guys, we're not doing a good job. We're not doing a good job. Omicron variant is definitely causing problems. And for those who are seeing this video saying that, like, oh, well, the symptoms are lower, that's great and all. But the problem is that if over 500,000 of y'all get that every single day, that means there's the wider pool of people who can get severely ill, right? Like if this was the Delta variant with this amount of numbers, oh my God, the amount of deaths would skyrocket. So we're fortunate, very fortunate, that it's not the Delta variant, at least in severity. But the problem is, because the Omicron variant has smartened up and said, hey, the Delta variant wasn't good passing around, I'm going to be better at getting passed around. Everyone's getting it. And because everyone is getting it, as you can see, our numbers are skyrocketing. And as our numbers skyrocket, that's still going to put a lot of people in the hospital. That's still going to result in a lot of deaths. right? Especially if you're not as protected as you need to be, guys. So again, that's where I leave you here. If anything, right? If you take anything, one, right? If you haven't been vaccinated yet in 2022, I don't know what to tell you. But if you got vaccinated, haven't got boosted, make sure you get boosted. Wear your mask, social distance. Here on behalf of Dr. Pierre, Pierre Medical Consulting, I want to tell you we are for the teachers. So if the teachers say they want to do virtual schooling because they don't feel safe, I am standing behind teachers every single day of the week. It just is what it is. And again, I understand that may put a burden on me and other parents, but like, hey, they have kids they have to worry about as well too. They got parents they gotta have to worry about as well too, right? So I'm not indifferent that they're not like real people just because they have the title of teachers and they help kind of lessen my burden in that regard. So again, you guys be great. You guys be great. Again, I'm gonna see you guys next week for another episode of Real Physician Reacts.